Hello, this is Dr. Tariq. My topic today is medical terminology, suffixes and prefixes. Uh, Word roots I already talked in my previous video. Now, today I am going to give you some examples of suffixes. The suffixes are these are 5-6 suffixes. It all mean the same, pertaining to or related to. Ik, ik, dermic, pertaining to skin. Ak, cardiac, pertaining to heart. Cardial, cardi, pertaining to heart. Subcutaneous, sub mean under, cutaneous means skin, as mean pertaining to pertaining to under the skin. Pharyngeal, pharynx mean thorax, throat. El mean pertaining to, so pertaining to throat. Pulmonary, airy mean pertaining to, pulmon mean lung, so pulmonary mean pertaining to lung. So all these words, suffixes, ik, ak, al, as, el, eri, they all have the same meaning, pertaining to or related to. Then come suffixes which has some pathology. The first such suffixes are algia and dynia. Algia mean pain and dynia mean pain. So, and the word root is gaster, stomach. So I joined gaster with the algia, gastralgia, pain in the stomach. And I joined gaster with the dynia, gastrodynia, pain in the stomach. Both have the same meaning, gastrodynia or gastralgia. Next suffix is stenosis. Stenosis. Stenosis means narrowing. Something has become narrow due to certain reasons. Something has become narrow. Stenosis, narrowing. Example is arteriostenosis. Arteriostenosis. This means artery has become narrowed. Arteriostenosis. Next word is atherosclerosis. Stenosis, arteriostenosis. So next suffix is malacia. Malacia mean abnormal softening. Malacia mean abnormal softening. And another suffix is opposite to, which has meaning opposite to it is stenosis, sclerosis. It means hardening. Malacia is softening. Sclerosis means hardening. From Malaysia, we make the word osteomalacia. Oste, oste mean bone, O vowel, Malaysia. Softening of the bone. Osteomalacia. The bones become hard because of or strong because of phosphorus and calcium. In Middle East, ladies do not sit much under the sun, so they lack vitamin D from the sun, and their bones are soft. This is quite common among ladies in Middle East. Osteomalacia, soft bones. And this disease is in adult. If it occurs in children, it is called rickets. This is soft bone in children, and soft bone in adults is known as osteomalacia. Sclerosis, osteosclerosis. The next word is sclerosis, hardening. Malacia was softening, now hardening. Example is arteriosclerosis. Arteriosclerosis and atherosclerosis. Artery, atherosclerosis. Sclerosis means hardening. Artery means artery. So artery has become hard. Arteriosclerosis. And atherosclerosis, it is telling you the reason also why the arteries have become hard. Ather is fat tissue, fatty tissue. So fat has been deposited in the wall of the arteries. That's why they become hard. And that is known as atherosclerosis. Hard arteries because of deposition of fatty tissue. Atherosclerosis. Atherosclerosis means hard bones due to deposition of hard arteries due to the deposition of fatty tissue. This was sclerosis and malacia. Next is Magali. This is another suffix. Magali. It means enlargement. Magali means enlargement. There are many organs in the body which become enlarged due to diseases, and they have different names. Number one, cardiomegaly. Cardi is heart, megaly means enlargement. Number two, hepatomegaly. Hepat is liver, megaly is enlargement. Number three is splenomegaly. Splen is spleen, is a word root for spleen. Splen is spleen, megaly is enlargement. Hepat is liver, megaly is enlargement. Cardi is heart, and megaly means enlargement. So cardiomegaly, hepatomegaly, splenomegaly. These are three containing three suffixes which mean diseases. Megaly, it has become enlarged. The reason for enlarged liver is could be hypertension, some valvular disease, or some cardiomyopathies. And the reason for enlarged liver could be hepatitis, some tumor, or maybe cancer. So hepatomegaly enlarge liver. Liver, if you want to palpate under the ribs in abdomen, it is not palpable. But if it is palpable, even one finger, it means liver is enlarged. Hepatomegaly. This is enlarged liver. Splenomegaly, enlarged spleen. This can happen in chronic malaria. Spleen become enlarged and it spreads towards the right iliac fossa, and you may find enlarged spleen in the right iliac fossa. It is so big. So that is an example of splenomegaly, hepatomegaly, and cardiomegaly. Next is another disease. Now I will give you example which are suffixes, but they tell us about procedures. Number one is stenosis. This is a suffix whose meaning is stenosis, making a surgical puncture to aspirate the fluid. Making a surgical puncture to aspirate the fluid. For example, there is water in the chest and we want to, definitely we will make some hole and then aspirate it. So that is known as thoracocentesis. 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 It means we have punctured the thorax and aspirate fluid from the chest. Thoracocentesis. Centesis means making a surgical puncture to aspirate the fluid from a cavity. Thoracocentesis means we make a puncture in the chest and aspirate the fluid. Number two example is amniocentesis. This is baby in the uterus of the mother, and baby is surrounded by membrane which is known as amniotic membrane. Amniotic membrane. And there is fluid inside, and baby float in this fluid 9 months, and this is known as amniotic fluid. Amniocentesis, we do this procedure if the family is suffering from some genetic disease. So at about 15 or 16 weeks, 15 to 16 weeks, the surgeon, of course gynecologist, take a long needle and enter it in this fluid with the help of ultrasound machine, and then aspirate some fluid out, and from this fluid baby cells are there. We can map out the DNA of the baby. If the baby is also suffering from the family genetic disease, then we can know what the baby will be normal or will be born with the family disease. So this is amniocentesis because the membrane name is amnion and the fluid is also called amniotic fluid. Next, next is scopy. This is another procedure which this is another suffix which means procedure. Scopy. Scopy mean visual examination within. We cannot examine what is inside the abdomen or what is inside the joint, but there are some instruments we can use them and see inside, and that is known as visual. If we see inside, that is known as visual examination from within. For example, laparoscope. Laparoscope. Gastroscope. Proctoscope. With the help of laparoscope, we can see what is inside the body, inside the abdomen. We can see is there any bleeding, is there any tumor or foreign body. Now, this laparoscope is being used to do some operations as well, like laparoscopic cholecystectomy, which is commonly known as lap chole. Lap chole. Lap chole. Lap is laparoscopic, chole is cholecystectomy. Lap chole, abbreviated as lap chole. So this is through the laparoscope. We use laparoscope, we make some hole and enter inside the laparoscope and do the cholecystectomy. So we can aspirate fluid from the some cyst. We can aspirate pus from the abscess. We can drain abscess. We can take biopsy. We can stop bleeding. So even some small procedures is being done with the laparoscope. So this scopy means internal visual examination. Next is gastroscope. Gastro is stomach and scope mean instrument to do internal visual examination. You can see inside with your own eyes. Camera is outside, camera is inside, light is inside, and your screen is outside. So you can see from the screen how the stomach look like from within. And if there is any bleeding, you can stop it. If there is any tumor, you can take biopsy. You can give some injection. You can stop bleeding through gastroscope. So this is gastroscopic. And number 3 is proctoscope. Proct mean rectum. Proct mean rectum. And scope, I just told you, is instrument for internal visual examination. So we can see inside the rectum. We can even see further in the large intestine, that is known as sigmoidoscopy. Next to rectum is sigmoid colon. So we can go there with the sigmoidoscope and we can do visual examination in that area. Is there any tumor, any cancer or ulcers? We can see with this sigmoidoscopy. We can diagnose with it. Sigmoidoscopy. Laparoscopy. In the lapar mean abdominal cavity. Gastroscope, it is stomach. Proctoscope, it is rectum. This is also called proctoscope is the instrument, and the examination done is known as proctoscopy. Next is plasty. This is a pro, suffix which telling us about the procedure. Plastic is plastic is like plastic surgery. It is also known as surgical repair. The word is rhinoplasty. Dermoplasty and dermoplasty. Rhine is nose. Plasty is surgical repair. So surgical repair of the nose. Surgical repair of the nose. Rhine means nose, plasty means surgical repair. Dermoplasty, plastic surgery of the skin. Sometimes the skin is not good. Sometimes there is no skin due to burns or maybe due to accident. So we have to do dermoplasty. Two more is example are myoplasty. Myo is muscle and other is neuroplasty. Both these muscles, and by my mean muscle, NEUR, neur mean nerve. So both these things, muscle and nerve, they are injured or damaged in accidents. So then the surgeon has to do the repair. That is known as myoplasty if it is done on the muscle, and that is known as neuroplasty if it is done on the nerves. Another example of it is mammoplasty. Mammoplasty. So mammo is breast and plasty is surgical repair. Surgical repair over the breast. This is about the suffixes. Suffix, I told you by definition, is that part of the medical term which come after the word root to to modify the meaning. It gives us information about four things. Number one, procedure. Number two, condition. Number three, disease. Number four, disorder. After giving examples of suffixes, I am going to prefix. Prefix is that part of the medical terminology which comes before the word root to modify the meaning, and it gives us information about four things: location, time, location, time, number, and the example is everybody is familiar with the word natal. Natal mean nat and al. Al mean pertaining to. Al mean pertaining to, and nat mean delivery or birth. So when the girl is pregnant, she goes 9 months to the doctor, gynecologist, for prenatal. It means before the delivery. She has to go monthly for examination. That is known as prenatal. So pre comes before the word root. Nat is word root. Al is suffix and pre is suffix. Prefix. Prenatal. to modify the meaning. Number 2 is postnatal. Postnatal. Post means after. Pre means before. Post means after, pertaining to after the delivery. Postnatal. Prenatal was before the delivery, and this is postnatal. The number 3 example is perinatal. Peri means surrounding, like periphery, periphery of the city. Surrounding. So perinatal is surrounding the delivery, time of delivery. It could be before, like prenatal, it would be few hours before, during the pregnancy, that takes like in primary gravida, that takes like 18 hours. So anything can happen in 18 hours, and few hours before the delivery, during the delivery, and few hours after the delivery. This is a period covering before the delivery, during the delivery, and after the delivery. So anything can happen. So it has to be looked for. Prenatal, natal, and postnatal. This was all about the suffixes and prefixes. Thank you very much.